Okay, final step is step 20, trap fiber analysis. We've done this before, but there's 7 points along the upper trapezius. So point number 1 is at the angle of the clavicle and the spine of the scapula, and then point 7 is just lateral to the T1 spinous process. And then each point, so 1, 2, 3, 4, 5, 6, 7, goes in an arc about a thumb width distance from each other. So you're gonna press onto each point, increasing your pressure as you go up in number, and then you're going to ask the patient which point is the most tender, then which point is the most tender on the other side, then which point of the 2 most tender points is the most tender point. So you want a single point. Then you're going to use your chart, and from that single point you'll have associated vertebral levels with that point. So say we had point 4 was the most tender, it would be cervical spine, C4, T-spine, T6, and lumbar spine, L2. So we'd go to each of those vertebral levels, palpate them, and determine which one's the most tender. So say T6 was the most tender, so we'd come to T6, and then we'd use a knife edge contact supported, and it's an I to S slight P to A thrust to clear that segment.